An ovarian cyst is actually a sac that forms in the ovary. It can be fluid-filled, but sometimes there may be solid areas within it. It can be normal and it can also be abnormal. I will talk about it later. The cyst can be formed by only one sac, in which we call it a unilocular cyst, or it could be formed by multiple sacs, which we call a multiloculated cyst. It can occur on one ovary, in which we call it a unilateral cyst, or it can occur in both ovaries, in which we call it a bilateral ovarian cyst. There are many types of ovarian cysts in women, but I would simply categorize them into two categories, namely the functional cyst and the pathological cyst. Now, what is a functional cyst? A functional cyst is a normal cyst that occurs in a normal menstrual cycle of a woman. It starts off as a follicular cyst, which is a cyst that contains the egg. This follicular cyst will increase in size to about 2 centimeters, during which ovulation will occur. Upon ovulation, this cyst will then convert into another cyst called the corpus luteal cyst, and the corpus luteal cyst function is to produce hormone called progesterone, which will support the pregnancy if the woman falls pregnant. If the women do not get pregnant, the corpus luteal cyst will disappear and a new menstrual cycle will form. These are functional cysts and these are normal and they do not have to be treated. Pathological cyst, on the other hand, is an abnormal cyst that occurs in the ovary. It can develop from the different tissues in the ovary, and therefore, being abnormal, they have to be treated. What are the commonest pathological cysts that we see in a woman? The commonest one that we see are endometriotic cyst, dermoid cyst, mucinous cyst adenoma, and serous cyst adenoma. An endometriotic cyst is a cyst that is filled with brownish stale blood, and sometimes we call it a chocolate cyst. A dermoid cyst is a cyst that contains sebum, which is an oily yellowish substance, and it has also components of hair, bone, brain tissues. And mucinous cyst adenoma is also an ovarian tumor that contains some mucinous substance within it. Serous cyst adenoma is another ovarian tumor which is benign, and it contains very clear fluid in the sac of the ovarian cyst. Now, what are the common malignant ovarian tumors or cancerous ovarian tumors that we see in the women? They are the serous cyst adenocarcinoma, the mucinous cyst adenocarcinoma, malignant teratoma, and also the clear cell carcinoma. The majority of the ovarian tumors are actually asymptomatic. However, when the ovarian tumors become big, or when they twist, which we call torsion, or when they rupture, or when they get infected, that is when they present with symptoms. The common symptoms that we see are pain, and patients can have sharp pain when they present with torsion or when the ovary twist, during which case the blood supply to the ovaries are actually compromised, and so therefore there is some destruction of the tissues, and sometimes this can also cause infection as well, so they can present with fever. The second thing that can occur in patients with ovarian tumors are pressure symptoms, because as the ovarian tumor becomes big, they can cause some bloatedness, discomfort. It can press onto the bladder, and so they can cause urinary frequency, and sometimes it can even obstruct the bladder and so cause urinary retention. They can also press on the bowel, and so it can cause bowel symptoms. Right. Now, in this category of the endometriotic cyst, patients usually present with dysmenorrhea, which is painful menstruation. They can also have painful intercourse because there are deposits of the endometriosis at the back of the uterus, and sometimes they even have deposits at the rectum or the sigmoid colon, which are the intestines adjacent to it. So therefore, they can present with symptoms of painful defecation, bleeding during defecation. And they also have a sensation that they want to pass motion, but they are unable to do so during menstruation, and this is what we call a tenesmus. Some patients actually present with abnormal menstruation. That means they have abnormal bleeding, intermenstrual bleeding, or they can have bleeding that is bleeding in between menses. Some of the patients with cancer, they actually can present with other non-specific symptoms such as malaise and fatigue, and even loss of weight and loss of appetite, by which case the cyst, the ovarian cancers can be quite advanced. The majority of ovarian cysts are diagnosed by chance because they are asymptomatic. They can be diagnosed during routine screening, by pelvic examination or by abdominal examination. Okay, or when the patient comes with some abnormal tumor markers, we actually do a routine scan, and so therefore these ovarian cysts are being picked up. They can also be diagnosed by ultrasound scan, which can be done for other unrelated causes. Now, doing an ultrasound scan is important in the diagnosis of an ovarian cyst because it tells us the site of the ovarian cyst, the size of the ovarian cyst, the nature. That means we can see whether there is unilocular, or it can be multiloculated, or there are also some solid components inside there which are suggestive of the possibility of cancerous components. On top of that, we can also see ascites, which is a fluid in the abdomen, which is also a feature of an malignancy or cancer. Apart from ultrasound scans, we sometimes have to do CT scan, especially when we think that the ovarian cyst has potential of being malignant, or it is suspected of being malignant as well. The other test that we also order is a blood test called CA125, and CA125 is actually a non-specific marker, but it will be highly raised in a patient that has got ovarian cancers. The treatment of ovarian cyst very much depends on the size of the ovarian cyst, the nature of the ovarian cyst, and also the symptoms that the patient presents with. Functional cysts do not have to be treated at all because they are normal. Sometimes ovarian cysts are very small and they do not look malignant. That means they are benign and is less than 5 centimeters. We sometimes actually monitor them and see whether they will increase in size over a period of time. If they do, then we will have to treat them. However, in endometriotic cysts, patients can have very small endometriotic cysts and they can be very painful during menstruation, or they present with fertility, and this cyst, they have to be treated as well. Patients with large ovarian cysts definitely have to be treated, or they become symptomatic, then like they have abnormal bleeding, or they have pain, or they have bloatedness. And of course, the patients that has got ovarian cysts which are highly suspicious of cancer or potential of becoming cancer, then we have to treat them. Treatment of ovarian cysts has to be surgical. That means we have to surgically remove them. We have two methods of actually removing the ovarian cyst. One by laparoscopy, two by laparotomy. Laparoscopy is a keyhole surgery. It is an endoscopic surgery whereby we use telescopes that are inserted into the abdomen, and then we would use instruments to remove the cyst. It is very commonly being used in most gynecologists. And many ovarian cysts can be removed with laparoscopy. And it has the advantage of having a small scar and less painful, and so therefore the patient has a shorter hospital stay and the recovery is very, very good. However, there are some ovarian cysts that has to be approached via laparotomy. A laparotomy is a surgery that has to be done via an abdominal incision. Cysts which are very large, cysts which has solid tumors, cysts which has malignant potentials, then we will have to do a laparotomy. During the laparotomy, we will remove the cyst in total without rupturing it as as much as possible, that we may have to send for frozen section, which is a histological examination in the operating theatre to determine whether the cyst has cancer or not cancer. If cancer has been confirmed, then we would do the full proper surgery for an ovarian cancer